My name is Richard Welbourn. I'm a consultant bariatric surgeon in the Nuffield Hospital in Taunton, which is in Somerset in the southwest England, and we've been using the Allurion Balloon for 3 and a bit years. The Allurion Balloon has an advantage over other intragastric balloons in that it's swallowed, which means the placement is an easy outpatient procedure that takes about 20 minutes. And the patient doesn't need to have any other procedure to take it out, because after about 4 months it passes naturally through the body. The Allurion Balloon is a simple outpatient procedure that doesn't involve any anaesthetic or sedation or endoscopy. The balloon is inflated inside the stomach, and the way it works is that it delays the emptying speed of the stomach. And what that means is that after eating a small amount, a patient will feel full, and that fullness will continue for much longer than it would have done had they not had the balloon in place. And it works very well. The follow-up program and management program for patients having balloons is comprehensive. We have a patient coordinator, we have dietitians and nurses who are very well versed in looking after patients with balloons. And so all that is in place to help the patient during the time that the balloon is in their stomach. So our balloon program is for the time the patient needs it. We start when we have first contact with the patient and preparing them. We give them a very comprehensive education program to help them understand what the balloon is all about, to help them make changes in their lifestyle, which they'll need to do to help them lose weight. And it's there in place for the full 4 months that the balloon is placed, and afterwards as much as the patient needs. So the question is, how much weight can patients lose with the balloon program? We talk about a percent total weight loss. With the balloons, patients lose between about 10 and 15% of their total weight after the balloon placement. One of the questions is, after the program, are patients able to keep the weight off? The answer is yes. It depends very much on how well the patients have been able to adapt their eating behaviours and programs. But what we find is that as the weight comes down, patients' quality of life improves, they become much more functional, and their diabetes or other obesity-related conditions can improve. And sometimes patients want to come back and have a second balloon in a few months after the first balloon has gone, to help them with further weight management progress over the next year. The company provides a watch that patients can use to talk to some scales, which the patients use to weigh themselves, and in combination what the scales do is to provide weight every few days whenever the patient wants to weigh themselves, and that is connected to the watch, and that connects to an app which enables the patient to track their weight loss in real time. The electronic digital health backup helps the patients keep motivated, engaged with the program, and helps them lose weight, and it's really effective. So adding digital to healthcare programs, especially with the balloon program, is an excellent way to maintain weight loss and motivation. I think the balloon program has a very good place in the long-term weight management of patients who are considering which options to have, and who may not want to have something more invasive like bariatric surgery. And they also may not be heavy enough to meet the thresholds for bariatric surgery. And certainly if they can have something non-invasive, which means there are no skin incisions, there are no tubes placed, there's no endoscopy, it's done as an outpatient, it can be a really, really effective, helpful modality that is a way to help them kickstart that weight loss and get very good weight loss. So we've had many success stories. There are some patients, a lady in her 60s recently who needed to have a knee replacement because she had bad arthritis in her knees, and she was told she couldn't have surgery unless she lost weight, and she chose to have a balloon and did really, really well. And 6 months later, I hadn't seen her for some time, and she ran into the clinic and gave me a big hug and said, "Look, my knees are brilliant. I now don't need my knee replacements." So that was fantastic.